In this video, we are going to talk about epinephrine. So let's get started. So, what is epinephrine? Epinephrine is a direct acting adrenergic agonist. It binds directly to the adrenergic receptors on the affected organs without interacting with the presynaptic neuron. Epinephrine is a naturally occurring neurotransmitter. It is produced and stored in the chromaffin cells of the adrenal medulla. In the adrenal medulla, norepinephrine is methylated to form epinephrine, and on stimulation, 80% of epinephrine and 20% of norepinephrine is released by the adrenal medulla in the circulation. Epinephrine interacts with both alpha and beta receptors. On low doses, it has beta effects, and in high doses, epinephrine has alpha effects. So, what are the actions of epinephrine? The actions of epinephrine are majorly on the cardiovascular system. These actions of epinephrine on the cardiovascular system is via beta receptors, beta 1 receptors. Epinephrine produces both positive inotropic and positive chronotropic effects, meaning epinephrine strengthens the contractility of the myocardium, which is positive inotropic, and it also increases the rate of contraction, which is positive chronotropic. So it has both the effects. Also, epinephrine acts on the beta 1 receptors on the kidney, causing the release of renin. Renin is an enzyme which produces angiotensin II, which is a powerful vasoconstrictor. So, overall, what is the effect of epinephrine on the blood pressure? So, what does epinephrine do? Epinephrine constricts the arterioles in the skin, in the mucous membrane, in the viscera because of its alpha effects. Also, it dilates the vessel going to the liver and the skeletal muscles due to its beta 2 effects. The renal blood flow is decreased. So, the overall cumulative effect is the increase in systolic blood pressure and slightly decreased in the diastolic blood pressure due to beta 2 receptor mediated vasodilation in the skeletal muscle vascular bed. So, now let's talk about the effects of epinephrine on the respiratory system. Epinephrine causes powerful bronchodilation, and this bronchodilation is because of its effect on the bronchial smooth muscles via beta 2 receptors. It also inhibits the release of allergy mediators such as histamine. Epinephrine also causes hyperglycemia. What happens? Epinephrine causes increased glycogenolysis in the liver, and it also causes increase in the release of glucagon, and both of its effect is via beta 2 receptors. Also, it causes a decrease in the release of insulin, and this decrease in the release of insulin is via epinephrine effect on alpha 2 receptor. So overall, increased glycogenolysis, increased glucagon release, and decreased insulin release leads to hyperglycemia. In addition to hyperglycemia, epinephrine also causes lipolysis. Epinephrine initiates lipolysis through its agonist activity on the beta receptors of the adipose tissue. What it does, it increases the levels of CEMP and stimulates an enzyme lipase which hydrolyzes the triglycerides into free fatty acids and glycerol. So now let's talk about the therapeutic uses of epinephrine. To memorize the therapeutic uses, you must memorize this mnemonic A, B, C. So epinephrine can be used in the cases of anaphylactic shock, anesthetics. It is also used in the case of bronchospasm and is also used in the cases of cardiac arrest. So what happens that epinephrine is the drug of choice for the treatment of anaphylaxis and hypersensitivity reactions. It is also used as a part of local anesthetic solutions in low concentration. So what does epinephrine do? Epinephrine increases the duration of the local anesthetic by producing vasoconstriction at the site of injection. So this helps the local anesthetic to persist at the site of injection for a longer time before it is absorbed in the systemic circulation. Moreover, epinephrine is also a primary drug that is used in the cases of bronchoconstriction, emergency cases of bronchoconstriction like anaphylactic shock, acute asthma. So it's a drug of choice and it can be life-saving in this setting. And within a few minutes of administration of this epinephrine subcutaneously, the respiratory function is greatly improved. So in addition to this, epinephrine is also used to restore the cardiac rhythm in patients with cardiac arrest. So now let's talk about the pharmacokinetics of epinephrine. Epinephrine has a rapid onset of action, but it has a brief duration of action because it is rapidly degraded. The preferred route is IM. Then it also can be administered via IV, subcutaneous inhalation, endotracheal tube. It is metabolized by the enzymes MAO, monoamine oxidase, and COMT, catechol O methyltransferase, and it is excreted. The metabolites are excreted in urine. The adverse effects of epinephrine can be memorized by learning this mnemonic HATE. So epinephrine may cause headache, anxiety, tachycardia, tremors, and pulmonary edema. So that's it. Thanks for watching. If you like the video, don't forget to like, share, and subscribe PharmCept. Thank you.